Good afternoon, everyone, and welcome to another one of our Marketing Moments webinar series hosted by CareTime and 52 Weeks Marketing. My name is Julio Barea, Vice President of Sales for CareTime. We're a software company that helps agencies make more money by being more efficient, helping you retain your caregivers. I'm joined today, as always, by my closest and dearest business partner, Debbie Miller, and friend. Good morning, Debbie. How are you? She's the founder and CEO of 52 Weeks Marketing and also the founder of Senior Helpers in Nashville. Good morning, Debbie.
Good morning, everybody. Great to be with you again today.
How many is this? I think we've been doing this now for almost 2 years.
Yes. This is our fourth session for 2025, but we did something like 11 or 12 last year. So it's getting up there, and we had a huge response. We had close to 200 registrants for today, so that's pretty amazing.
We really did, and you and I were talking before the webinar about how many people on this call are here because they go to all of ours and they're kind of followers of yours. And if you're on the chat right now, it'd be helpful if you just jump on there and say, yes, I'm a repeat customer, and I'm here. And if you tell us how many of these you've attended, that'd be super useful for us to know. And we appreciate it if you've made it to more than 3 or 4 of these. We'll create a whole new fan club for you guys, and we'll have to figure out a good cool name for that. Debbie, it's really interesting because I always say I'm super excited about this one. This one I'm super excited, but I'm also very curious about it because it's such a change of pace from what you usually do. When you sent this over and we were taking a look at it, it really caught my eye because dementia is a huge problem. I have a personal connection to it, and I know you do a ton of this kind of work in your business. And before we jump into things, what drove you in this direction to kind of think about stuff like this?
Well, specialty programs in general are really important to help differentiate you. And we'll talk a little bit about how noisy this industry has become. It's become so much more competitive. So finding little niches that you can truly hang your hat on and differentiate yourself from all the other agencies out there is going to be really beneficial. I was thinking about this the other day as I was working through the development of the presentation. And I remember years ago, and you might remember Gentiva, Julio, years ago, they had a program called Safe Stride. And they were the who's who of home health, definitely in my area. And I remember talking to an Amedisys sales rep who was so frustrated with Gentiva because they had this program called Safe Strides. And it was nothing different. They don't do anything different than Amedisys did in terms of like balance and, physical therapy and all of those things. They just packaged it up with this great little term and called it Safe Strides. And they got so many referrals for this program. So it got me thinking from that early stage in my business to be looking at creative marketing solutions and ways to package up care that will really help you stand out and obviously end up getting you some more referrals. So that's kind of where it all came from.
You have to admit that Safe Strides is a great name. It's like silver sneakers on the Medicaid Advantage program.
Exactly.
It really catches.
For sure. But do you know, I got so curious about it because I hadn't heard about it in years. Well, Gentiva went through so many sales and mergers and this and that. The program doesn't exist anymore. So there's an opportunity for a specialty program for somebody.
If you're out there and this is something you want to do, there you go. She just gave you a great business idea. Yeah. So before we get started, and I hand it over to Debbie to do her usual wonderful thing, we're going to talk about marking your calendars for the next session. Discover how to position yourself as a home care expert through education, becoming the go-to expert. And honestly, anything you do for a living, you should try to consider yourself and make yourself into an expert. When I started down this road 7 years ago, I knew books about Medicaid. I said to myself, I'm going to become a Medicaid expert. And who knew? People actually pay me to speak about Medicaid, which still blows my mind every day. But we hope that you join us. I'm looking forward to that one.
Yeah, and it's really going to build on today's session. Today, we're going to be talking about specialty programs. We're going to take it a little bit more detailed and like just sort of everyday stuff that you can do to bring education as an added value to your referral sources. So it'll be a good one.
Yeah, and as you've said a million times before, the more you offer and the more varied you are and what you're able to offer, the more likely you are to be able to increase your business and get more referrals, which you've been preaching, I'm sure, far before I met you, but definitely since I met you for sure. So
Hmm.
Debbie's going to talk about tips for executing specialty programs. She's going to learn how to specialize in unique specialty programs, and she's going to give you some ideas on how to promote them. But before we get started, I have a couple of questions we'd like to ask. Why do you think specialty care programs would be valuable to your organization? And we want to know, do you think they'll stand out or differentiate you, grow your business, position you as a senior care expert, or all of the above? If you'd like to take a couple of seconds and answer that one, maybe you don't know, but this is a great time to find out. While you folks are doing that, we'll jump over here and see what we have as some kind of results. Don't leave me hanging, folks. I know you're out there. Give me some answers for the questions. We'll get those in a moment. I'll come back and there you go. I'm going to come back and check on those. Are you offering any specialty programs currently? Yes or no? And then I'm going to push that out. Great. So we have 10% folks say to help you differentiate and 10% position you as a senior care expert. What do you think, Debbie? I think those are all really great ways to decide to use this.
All the above. That's definitely what I thought most people would say, and it's true. It really will help you
Here's
do that.
here's the most interesting one. Are you offering any?
Wow.
No?
Wow.
100%. I would say, folks, you are at the right meeting today. This is
I'll say
this
that's
is exactly
exciting.
where you need to be. So I think, Debbie, there's no better segue than that question to hand it over to you. So why don't you take it from here?
That's exciting. Well, I am really looking forward to presenting this, and I've put a lot of effort into this. And in fact, this is a really meaty presentation, and we always send out the recording. If you want to go back over it with your team, we can absolutely provide that to you. But it got me excited as I go into the 2026 planning session. So it really got my creative juices flowing, and there's some things that I've even really uncovered that I want my team to focus on. So let's dig in and talk a little bit about why these programs are so valuable. And most of you identified the things, but one of the key things is helping you stand out in a noisy crowd. I don't think I've ever seen home care be more competitive than it is right now. And if I had a dollar for every time a home care marketer said, at a networking event, well, I provide non-medical home care. Ay, ay, ay. And everybody provides non-medical home care. If that's all you've got, you're going to struggle to differentiate yourself. The next one is it allows you to showcase your expertise. You said this, Julio, become the expert, right? Specialty programs really show how you have that expertise in that particular area. And it shows you have authority, right? Whether it's memory care, with patients with COPD, PD, with CHF, etc. The next one is you can win trust of your referral sources. It's like the program that I told you about with Gentiva, Safe Strides. They got so many of the referrals, and particularly anybody that had a fall. When you think about how many people are in the hospital because of a fall, they got all those patients just because of that program. So your referral sources prefer agencies with a proven and structured program that solve a problem that they have with their patients. So that's something to keep in mind. Drive better outcomes, right? Anybody that is targeting specific problems, you're typically going to be able to deliver results. And if you can measure those results and share those measured results, even more advantageous for you. Increase revenue opportunities. So these specialty programs they can command a higher price. Julio and I were talking about that. Particularly when you're working with other payer sources, they may be willing to pay a little bit more for a specific program that helps them solve a problem with their patient population. Boost caregiver engagement and retention. This is very interesting. We've all got issues with caregiver retention. Here is a way to have sort of like a step-up program. I'll talk a little bit more about that for your caregivers that you can advance them through, kind of like a career ladder program where they can specialize in certain care programs. You can create a clear and marketing edge. That's pretty obvious. Something different, something to tell a different story about. This makes life so much more interesting for your marketer, that's for sure. So we'll talk more about what that looks like as far as marketing goes. All right. Well, so sorry, I'm pressing the wrong button here. I love this new format, by the way. It's very, very fancy. But your team behind the scenes, Julio, does a great job, and Casey's on. Thank you, Casey, for making us look good here. So when we think, obviously we think this is a good idea. Now, where do we start? So the first one is you want to explore changes or trends in the industry that are creating opportunities for home care. And for you specifically, there may be some unique situations that are happening in your community that you can capitalize. You got to analyze that. Those are factors that you want to consider. The next thing is through that understanding and those specific needs, you will create a specialty program that's going to differentiate you and help you diversify your business. And then finally, once you've created your program, it's time to market to all the key stakeholders. So we're going to get into more detail on all of these. So let's start with trends. This is really exciting. It is truly an exciting time to be in home care. I'm going to delve into some of the trends in more details. But the healthcare landscape is definitely shifting, and the front lines are no longer at the hospital. They really are within the hospital wall or outside of the hospital walls, right? So home is emerging as the new healthcare frontier. I love saying that. I think it sounds so scientific, but so exciting. So from hospital at home programs, dementia navigation, remote monitoring, veterans care, the most meaningful, cost-effective, and patient-centered care is really happening where people live, wherever that is. So don't discount independent living facilities, assisted living facilities, certainly homes within the community retirement facilities. Wherever a person calls home is where they want these new home care delivery models to be acceptable or to be accessible, right? So that's really key. So it makes sense then that the home is the center point, because this is where we can actually prevent the crises that often lead to the hospitalizations, right? So we can offer support that keeps folks independent while aligning with all of these trends that we're going to talk about. So it's pretty exciting. So let's delve into a little more detail here on some of these trends that are creating some real room for specialty programs. These are areas where home care agencies can build some programs out and ride on some of these waves that are happening. So there is a lot to unpack here. So I'm going to give you a general overview of each of the trends, and then I'm going to go into a little more detail on a few of them and give you some examples of what specialty programs might look like. So the first one here is dementia care goes mainstream, and that is with the CMS Guide program. So this is an 8-year model launched nationwide, and it pays for dementia care navigation, but it also pays for respite care. And that's where home care comes in. So we can build here a dementia navigation and respite activation program. So what we want to do is partner with your local guide participants, and they will portion off the respite care piece to you as their partner. Because most of these facilities, typically Medicare organizations, are not tooled to provide the in-home extensive care that we are. So there is a big opportunity to become an extension of their program, their guide credentialing, by offering that respite care. So I'm going to get in more detail on that one. All right, let's look at the second one here, which is hospital at home. This is still a really hot trend, okay? When you think about what happened during COVID and how these hospitals retooled themselves to provide those models at home, ACOs were moving in that direction. So we're still being able to capitalize on a lot of those things, and they need partners to implement those programs, because realistically, they don't have the army that we have that are able to go into the home and provide the assistance with daily living and all of those things that we do to keep them at home. So big opportunity there to build a, say, hospital at home extender team. So we become an extension of them. The next one here is remote care is not going away. I truly think this is here to stay. And so what you're seeing is more physicians now have an even higher appetite for home-based technology and human support, right? They are being penalized for their patients who end up back in the hospital. So they're very, very open now to partnering with folks that are going to help them keep their patients safely at home. So build this. You might create a connected chronic care program where your team can help with the devices, adherence to the medical regimen, whatever that is, eyes and ears in the home so that we can escalate any issues that we're seeing so that the medical team can intervene before that person ends up in the hospital. All right, the next one is the Medicare is expanding, okay? So the HCBS program, which is Home and Community-Based Services, this is the umbrella for the in-home personal care piece of the Medicaid programs. And these are state run through typically state waivers. The demand is absolutely rising across the country. And so I see this continuing to expand because this HCBS program is cheaper than institutional care. The government knows it. All right. So I would imagine that this was going to continue to expand. So if you're a provider, if you thought about being a provider and the reimbursement rates make sense, this is a big opportunity. So you could build out something called, say, Medicaid HRSN Fulfillment Hub and be recognized and differentiate yourself on being able to deliver those Medicaid programs for those patients that they're interacting with. All right, the next one is PACE. PACE is definitely building in momentum across the country. And what this is a federal state program under Medicare and Medicaid. And what it does is it serves the frail folks, so between the ages of 55, who would maybe qualify for nursing home but want to remain at home. And unfortunately, in my little area, we don't have a PACE program. We do have a pretty extensive Medicaid program. But I'm hearing from other owners across the country that this has become a huge opportunity for them. So what these are PACE centers. And often the services are needed at home. So they partner with an organization like a home care organization and offer that assistance with activities of daily living. So home care can really fit in as a partner, and it could be called the PACE Support Squad. So you could be working with a provider in your area and be that personal care support squad. All right, so just to give you some ideas. So definitely be checking those out, seeing if they're opening in your areas, and be the first to be contacting them, become a partner with them. All right, the next one is veteran care. That seems to be alive and well, and boy, do they reimburse well. So whatever you can do to build some programs here to support your veterans. I had a few years ago, I had hired a retired veteran. I called him my VA advocacy program. And so we were out there promoting him, and he would help them navigate through the process, which can be pretty complicated. So that's just, one of those specialty ideas that you could be thinking about, where you help them through the process and then coordinate the care and support them, and of course, the caregiver as well. All right, the next one that I wanted to focus on the trend is around the readmission pressure and the impact that this is having on healthcare organizations all across the country. And so this can create some real opportunities around transitional care niches. All right, so hospitals are facing penalties, and the average 30-day readmission cost is $16,000. So partners want to lower their bounce back. And so if you're talking about programs that sound like that kind of a solution, then that's going to get their attention. So you might want to build a 30-day bounce back shield. And that could include focusing on CHF, COPD patients, where you're offering support with the medication, a 48-hour home care visit, assistance with their ADLs, etc. So it might be a 5-day program that gets them home situated and comfortable and in a safe situation. And then the final one that I wanted to mention was the workforce crunch. We are all dealing with it, right? The direct care costs are the fastest growing in the country, with continual shortages for agencies. So if we can upskill into specialty tracks and that may help us to recruit more, but also if we can tighten our back office operations so that we can focus our really great staff on more specialty programs, that could really put us in a good position. So I'm going to talk a little bit more about that here. So wanted to kind of explain myself a little bit better. So the workforce reality is something that we're all dealing with, right? We've got the Bureau of Labor. I want to give you some of these statistics. Project over 1 million additional direct care workers are going to be needed, okay, over the next 5 years. I don't know where they're going to come from. Yikes. And yet we know the turnover is high, wages are low, and the competition from other sectors. I mean, we lose people to Amazon every day. It's not just within the home care industry. It's folks that are paying more than we're paying and become competitors as an employer. So this is a tough thing. So why is this an opportunity though? We can get creative. Most agencies are stuck in that generic track of competing head to head with other caregiving companies for the same labor pool, basically. So if we can specialize and upskill our workers, it could put us in a better position to recruit more folks, but also retain them. So training, having specialty training tracks where we can train in dementia care, maybe CHF and COPD, Parkinson's support, those kinds of things. We could create a career ladder, which is what I was talking about earlier, that gives them something to look forward to and have them really thinking more career-minded when they look at home care than just, it's that low-paying job that I ended up having to take. Caregivers often also feel really valued if we can position them higher than, say, just a sitter, right? I hate when I hear, oh, do you have sitters? No, I have care providers that, and then if I could say, I have specialty dementia care workers and blah, blah, blah. And then agencies maybe can charge more and pay more, right? So that's an opportunity as well. And ultimately, specialized programs win referrals. So you think about these PACE programs or, hospital at home programs. If you have specific trained aides, that's going to be really, really interesting to them. All right. You can, and when it goes to recruiting, you could say, hey, join our dementia specialist program. Or you're promoting your agency and say, we have dementia trained specialists. Wow. You've got their attention, when you're looking to maybe create a guide partnership, etc. All right. The next thing is operational, leveraging your operations for more productivity. So what do I mean by that? This is something that has really happened for me when we, even within our office, we're dealing with retention issues, right? And, schedulers and recruiters, etc. So if you can leverage, say, virtual assistants for the non-care pieces of your work, of your job, of your agency, you can assign some of those roles and free them up to be more specialized, to put some effort into specialized programs, into training your staff, etc. So I'll give you an example of this. So this has transformed my organization. I have 7 virtual assistants working in my senior helpers business, okay? Recruiting, scheduling, finance. What has been incredible about that is it's freed up my really good staff, like, strategic folks, to be able to focus on other programs. So I'll give you an example. Before this, I went to my daughter, who's my director of operations, and I said, Kirsten, I had this idea around a quick, rapid response for hospital needs. And she laughed at me. I said, I want to create a specialty team and call them the rapid response team. And she laughed. She's like, we can hardly staff and deal with what we've got. Like, that's crazy. But now, because we've got all of this support through virtual assistants, we've been able to free up time for my incredible staff who can actually get a program like that now off the ground. So that's what I'm saying is you've got to look also creatively on how you're running your operations to allow you the freedom to be able to bring some of these programs to fruition. All right, it's one thing to just say, yeah, I'd like to do this. It's another thing to bring an idea to fruition, and you've got to have that support to be able to do it. All right, so I just wanted to share that with you and get you thinking about that. So reframing this whole issue is, we're going to flip the narrative a little bit. And so what we might say is, yeah, there's a caregiver shortage, that's real, but we've turned it into an advantage by creating specialty tracks that attract workers, retain them, and give our clients that specialized care they need. Wow, does that sound different if you're at a networking event versus, hi, I'm Debbie, and I have senior helpers, and we provide non-Medicare medical home care. Yawn, right? Everybody does it. All right, so let's go here to so just to kind of flip the switch a little bit, it might be something new and novel that I just shared with you around the virtual assistants. But we've got a quick survey here. Are you interested in learning more about how virtual assistants can help you save costs and streamline your operation? Dylan and I saw such a need across the country with other home care providers, our 52 weeks clients who are getting bogged down in operations, that we created our own solution and now have a company to help folks get virtual assistants in place. So wow, big interest in that. That is awesome. So we can definitely reach out to you for some information about that. All right, let's move along here and talk about this, the kind of the roadmap. So from idea to impact, okay, building and executing your specialty program. And when I said this is meaty, I mean, you've got everything you need here step by step. I put a lot of effort into this because, I believe in when we do education, I believe I want to bring you some value to whatever we're presenting here. So let's just go through this, okay? And I'm going to kind of go through pretty quickly. The first one is defining the need and opportunity. We've kind of talked about that. But what is it? What are you going to focus on? Is it because of hospital readmission penalties, families who are desperate for dementia day-to-day support, whatever that might be, you want to define it. The next thing is describe the program clearly, all right? Describe it in 2 to 3 sentences. Who's it for? What does it solve? How does it work? Who are the referral partners? And how are you going to present this so that they remember it? The third thing is build the workflows internally, okay? This can take a minute. How is it going to affect every department in your organization? Who's going to be trained? What are the checklists? We've been doing Guide for a minute in my organization, and we made a change to how we're doing something. It's a long story, but it literally took me a week to redefine the workflow because I have a big organization. I have a lot of hands in the pot. A lot of different people are involved day to day. So it took me almost a week to tweak the new workflow so that it ran smoothly. So this isn't something that just happens overnight. Okay, so just FYI. Then you're going to train and upskill your staff. Okay, does it affect caregivers? How are you going to train them? Does it affect your schedulers? How are you going to train them? Who has to be involved and who's going to do the training? Next, create the tools. You want some handouts, you want some leave behinds, something scripted for your marketer to be out there talking about the program, leave behinds, those kinds of things to reinforce this program. It's like Safe Strides. It was everywhere, right? Everybody knew about Safe Strides. The next one is pilot the program, right? Do it with a few people, try it first, get your feedback, tweak the system, which is where we were with the guide. We had to end up tweaking something and had to kind of go back to the drawing board on the workflow. So that's perfectly fine to do that. And then get out there and market to your referral sources. So you want to use the language that is important to them. If it's focusing on outcome measures, fewer bounce backs, better quality of life, support for overwhelmed families, terminology like that. And then track your outcomes. The more numbers you have, the better it's going to be to market it. And refine and scale, right? Refine it across your payer sources. You may start with private pay and then move it into other, real payers, ACOs and things like that as you gain more and more outcome measures. And then finally, sustain and differentiate. My dementia program, we are very well known in my area for our dementia care program. It's happened over years and years. And so it's, the cool thing is if you stay with it, it continues to build momentum and it grows, and it truly will differentiate you. All right, so let's move on. Before I dig into some of the specialty ideas, I wanted to share, for some reason this does, oh yes, I see what I did. I didn't advance all that. Okay, here we go. So I'm going to share with you, this is like a 6-step roadmap to how to actually market your program, all right? And I'm going to kind of fly through these pretty quickly before I get to some of the ideas, some of the specialty program ideas. The first one is identifying your target referrers. Okay, so who is it that you're going to focus on and how best to reach them? All right, you want to match your program benefits to their problems, their patient problems that you now have solutions for. Then you're going to craft a clear value proposition, emphasize how the specialty program solves their pain points, and then highlight the outcomes, what you're doing, what your program's doing to solve those issues. The third one here is to create a tailored marketing program or materials, a one-page program flyer to educate them. You might have case studies, you might have a PowerPoint presentation, branded leave behinds, all of those things to get out there and actually deliver the message. Educate through conversations and presentations. So this is where you really begin to elevate yourself as that expert, focusing on that patient profile, what you're doing to resolve it, who that, whatever that program is. Offer lunch and learns and CEU programs to get the information out there as well. This is what we've done really successfully with our dementia care program here in Nashville. All right, number 5, leverage the specialty program branding. If you could come up with a logo, I'm going to give you some examples. That's awesome. Name recognition, really important. And then make it consistent on everything that you do, from your presentation decks to your brochure. If you're using your generic brochure and you've got that program, make sure that's on there so that key message continually gets reinforced. And then finally, follow up and build relationships. So keep the conversation going. It's not a once and done. Somebody has to hear something 7 times. We talk about that a lot with 52 weeks program. So being constantly reinforcing it everywhere you go, every conversation you have, you are, building on that messaging, and then, have a good reason to call on them again, maybe come in with a report card on how their referrals are doing within the program. So just to give you some ideas. All right, so some ideas. Well, let's take a deeper look at one of the trends that I talked about, which was around hospital to home program, okay? So these programs, as I said, are definitely growing rapidly across the country. And the challenge is that hospitals need the in-home care arm, right? Like us. So we have a huge opportunity here to meet this challenge. So what might that look like? Here is a program idea, and I've called it Hospital at Home Extender Program. See, I created a little logo. And so these are just things. And what's so cool now, I didn't have this, even a couple of years ago, where you can just go into ChatGPT and say, give me a logo for a program that you come up with. All right. And then you start putting it on things and creating materials around it. So these components of the program, what might you have here? A rapid response team, where you can be helping with that medicational support, family support and training. So these are things that you could build into the program and be marketing that as part of the solution. All right, so how does it help? Obviously, hospitals meet their quality benchmarks. It keeps them at home and out of the hospital, which is key, and it positions your agency as the essential community partner with those hospital at home model that everyone is either trying to implement or thinking about implementing. So how to frame it? Hospitals are under pressure to move more patients to hospital at home. But they need partners to handle the non-medical side of things, like safety suites, daily oversight, caregiver coaching. Our agency can be your hospital at home extender team, filling the gaps so we meet quality. You can meet your quality metrics, avoid readmissions, and keep your patients safe at home. All right, so you see how I've taken those key factors and implemented it through this particular program. All right, so these are just examples. You can run with it, or you can, just go to the drawing board and think this through. So again, just a quick little one pager that you can easily create. And again, using the logo Hospital at Home. All right, let's take a look at that other trend that I was talking about, where dementia has gone mainstream with the GUIDE program, okay? This is a big opportunity for specialty programs in dementia care. All right, so GUIDE stands for Guiding and Improved Dementia Experience. If you guys aren't capitalizing on this yet, you really need to do some research. Do a search on who is a credentialed provider in your area and get an appointment, get a meeting with them, position yourself as their respite care partner, okay? So this model is a game changer, okay? For the first time, dementia, CMS is actually paying for an in-home care program. So there's several components of it. There's a care navigation piece, and then there's a respite care piece. The respite care piece allows for 80 hours of respite care. So it's a great way to get them started with dementia care, home care, and then hopefully you're going to be able to extend them past that 80 hours. But this is not what most credentialed Medicare providers who are credentialed with the GUIDE program are able to provide. So there's a big opportunity here. So you have an opportunity to really become the go-to dementia solution. All right. So the challenge here for our community is that our caregivers are burned out, which is why this program was put in place. CMS recognized the burden of care in America is astronomical, and they want to give some relief to these family caregivers because they want to keep them in place, right? If family caregivers wash their hands of their responsibility, this would be devastating to our country. I don't know if people realize that. So families need support and respite care. So our solution, Memory Care Plus. That's our dementia program called Memory Care Plus. So we can turn the GUIDE model into a specific program for us. So again, I just created a cool little logo. And so what are some of the components for this one? Dementia and navigation care planning. I've got respite activation, specialized dementia care training for staff, daily living support, of course, family support and engagement, community and healthcare integration, and tracking and reporting outcomes, helping those credentialed providers to look good. They're probably going to have to justify and validate re-credentialing. And so the more you can do to help them with that, the better this is going to be for them. So again, just giving you some ideas on what you might incorporate into your Memory Care Plus specialty dementia program. So how it helps, obviously, it's helping to reduce your caregiver burnout, improves quality of life, and it positions, this is the important one, your agency as a GUIDE-aligned community resource. By the way, more and more people, more and more of our referrers, we started out of the gate really strong with this. We were educating our community or our referrers about the program because they knew nothing. More and more information is being delivered out there, but we led the way in our community, and so there's still lots of opportunity to educate here. So for healthcare partners, we're a guide-aligned resource. Send your families to us, and we'll have them help them through this whole process. For families, Every Day Matters, our Memory Care Plus program gives you help you can count on while you get the rest that you deserve. Okay, wow, I feel like I'm talking a mile a minute here, but it was a lot of information to get through today, and I told you, it was meaty. All right, so our another trend, I think this is the last trend that I'm going to really focus on here, and that is around the readmission pressure that a lot of our healthcare provider partners are contending with. Okay, it is significant. So the CMS hospital readmissions reduction program is put these folks in a position where they are being penalized for those people, particularly with conditions like CHF, COPD, pneumonia, stroke, and hip and knee replacement. So these are the specific patient populations that they've got their eye on and are expecting hospitals to keep them from readmitting. If they don't, they could reach a 3% Medicare penalty. That is significant. That is a huge financial hit for these healthcare organizations. So that's what we're going to be able to help them with. So why it matters for home care is because, as I said, these hospitals need community-based partners who fill the gap after the discharge. They don't have eyes and ears on what's going on in the home. We do, right? We are the only ones that can really help them with this huge problem. Yet they're the ones being penalized. So it behooves them to get a partner who's focused on some of these things. So think about what you want to focus on. What are the causes for hospitalizations? Falls is a big one. I'm going to focus on this in our next session around educational programs, educational things that we can be doing to educate the referrers in the population to reduce some of these things. Home care plays a huge role in affecting these issues. Poor medication management, huge issue for hospitalizations, and then improper disease management. So what's our solution? Our solution is to come up with transitional care niches, right? That's going to help you stand out by offering programs that aren't as so general care, but that focus more on these disease issues, right? That are sending folks back. COPD, CHF, stroke. It's going to be music to their ears because they're being measured on it. So what might that look like? Well, let's take CHF and COPD and let's come up with Breathe Better at Home program. Okay, so our solution is a 48-hour transitional visit. We want to, as soon as they get out of the hospital, we're there, maybe there for 48 hours. We're managing the daily symptom support, caregiver coaching, because disease management is obviously an issue. They need some education on how to better that situation, follow-up coordination, and rapid escalation protocols. So when we see those triggers, those red flags getting triggered, we have an opportunity to go back to whomever it was that referred to us so that they can intervene before that person ends up back in the hospital. So obviously these programs would support whatever escalation protocol that they have in place. We would just kind of wiggle our way in the middle of all of that and be that partner. So just another idea here, having a little fun, Breathe Better at Home program. Sounds so official, doesn't it? So how it helps? Well, it prevents costly readmission. It keeps families confident and seniors comfortable, supports physician care plans with reliable home care follow-up. That's really, really an issue, right? So how are we going to frame this? It's something along the lines of, did you know nearly 1 in 4 CHF patients bounce back within 30 days? And most of those readmissions are actually preventable. It's what happens at home. That's why we created Breathe Better at Home. It's a specialty program for CHF and COPD. It includes 48-hour transition visit, daily symptom checks, caregiver coaching, and rapid alerts if red flags show up. So if seniors, it keeps seniors stable, families confident, and hospitals protected from costly readmission. All right, so you see how I'm spreading all of these key components that you want to build into your program and certainly your marketing plan. All right, keeping with the readmissions issue, this was a program that I had created just to give you an idea. I called it a bridge to home. And it was a care management model where we would come on site and put together the care plan, do all of the things that we needed to really coordinate the care to reduce readmissions. And then, as you can see, we built out some of the materials that we used carrying that branding through. So again, I just wanted to give you some real life situations of things that I've done in the past myself. All right, so I'm winding down here. Woo, that was a lot. You staying with me, Julio?
100% here, and I am flabbergasted at the amount of detail that you provided. This could not be more valuable to somebody. I almost want to start an agency just so I can do this.
This is... yes, we'll help you do that. All right, so just to summarize here, again, exploring the changes and shifts that are happening in the industry, particularly in your area. Every community is a little bit different. And some people have opportunities that other people don't. If you've got a PACE program in your area, go for it. Get involved, get connected. If you're a veteran provider, you know, these are the things that some people don't have the opportunity to do. So figure out where the opportunities are. Start with one program. Don't kill yourself.
Great
Start
advice.
with one key program. All right, and also you don't want to frustrate your staff. As I said, there's a lot of carrying this through the whole organization. So start with a program that's going to, you know, really differentiate you, do all the things that we talked about, piloting it, training, all of those things. But don't feel like you got to go do 5 things. Do one thing. Do one thing, you know, maybe between now and 2026. And then, like, you know, if you kind of work on it now, by 2026, you could be really out there promoting it. You'll have gotten through all those steps. So think about it that way. And then, of course, you're going to be able to market your program, okay? And then follow that roadmap that I laid here before you. So, I'm going to turn it back to you, friend.
Thank you so much, Debbie. I think we'll give your voice a rest. That was fantastic. Really enjoyed that, folks. I know that there's been some great comments down there. I think my takeaway, Debbie, as always, is that you really lay things out. You don't just generalize, like you really lay out step by step on how to do things. And folks, I don't think you understand how valuable it is for somebody to give you that information. There's people that charge good money to teach you that information in the consulting world. And so it's incredibly valuable. I almost could get a college degree if I took all of Debbie's webinars and put them together and got a certificate or something in running an agency and marketing. I think the cool part about this, you're doing something good for people. Right? These are niche areas where people that really need the care, and they in many cases, in most cases, don't know where to go. They can't always trust the information they get. So when they run across somebody that sincerely and genuinely is trying to provide the care to their loved ones, it's very specialized. You have no idea the impact it has, not on just your business because you're growing, but on people's lives. It really is an important business. So if you'd like to learn more about 52 Weeks Marketing, their turnkey solution is the best I've ever seen. Or Helper Heroes virtual assistants to help streamline your operation. Looks like 100% of you want to learn more about that. Well done. Thank you very much, folks. The next question you want to ask, if you want to learn more about Care Time, whom I work for, and how we can help your agency be more efficient, help you retain your caregivers, and help you get paid faster through both our software platform as well as our billing services, specializing in Medicaid and in a lot of these niches that Debbie's talking about, we'd like to help as well. So please let us know, and we're happy to reach out. While we're asking that question, we want to talk a little bit about what are we doing next, Debbie? Next week, next month, we are doing again the Becoming the Go-To Expert. 2 months. That's right. We did. We split it up. October. Mm-hmm. So mark your calendars for October 22nd, Becoming the Go-To Expert, educating your community about home care. Do you want to give us a very brief preview, Debbie, of what you're going to talk about there?
Like I'm building on a lot of the things that we talked about today. So for example, around falls, okay, what can we provide educational, bringing some value around how home care reduces those falls. So I'm going to really help you all get focused on, again, a couple of key areas where you can truly bring some education to the table. You can wrap it into a lunch and learn. That's one of the things that Dylan is really helping a lot of our 52 weeks clients do, is pick a couple of these key educational areas. We've got some ready-made PowerPoint slides, and just getting out there. And again, every time you educate somebody, whether it's seniors themselves, the families, or referral sources, you're elevating yourself as that expert, like you said before. Like, you want to become that expert. And then what happens is they think about you when they see that patient. So, back to my safe strides. If I've seen somebody that's fallen, hey, and I've just been out there talking about what we do. We have a home safety checklist that we do before we begin our care for every one of our clients. That's a great educational model that you can bring to the table, that you'll be able to, again, utilize to differentiate yourself, and constantly be explaining how home care makes a difference for folks in those issues, dealing with those issues.
Thank you, Debbie. Folks, and it does make a difference. Don't mistake. This business makes a difference in people's lives every day. So thank you again. Thank you, folks, for attending. Join us on October 22nd. Good luck out there. Debbie, it's always a privilege to be here with you. Thank you so much for doing this with us.
You're welcome. Bye, everybody.
Bye, everybody.